So what the Right for Dad funds allowed us to do is to survey a large number of men at the Kingston Cancer Center, almost everyone over the last year who've been going through this radiation treatment. Everyone almost had the opportunity to fill this out, and of those who were asked, the vast majority did. So we've now got a very broad slice of the views of patients in our community undergoing this treatment about what's important to them. So we couldn't have done that without Right for Dad. The Right for Dad funding has primarily supported Kim as the person who's been implementing the survey, and has also provided a very modest amount of support for the radiation therapists who've helped us do this. But a lot of their labor was brought free to this task by the cancer centers, permitted them to distribute surveys and collect them for us without charging us for that. So it's been very instrumental in doing this.
So we wanted to find out about the quality of care that men are receiving as they're undergoing radiation treatment for prostate cancer. We wanted to get this information from the perspective of the patient. So we started our work by identifying a comprehensive list of aspects of care, of things that might be important to patients, and we incorporated those into a patient questionnaire. And that allows us to ask patients about the importance of these aspects of care, as well as the quality of care that they're receiving. So we've given it to patients undergoing treatment at the Cancer Centre of Southeastern Ontario with the collaboration of the Cancer Centre. And we have information collected from almost 100 patients at this point in time. So this represents the vast majority of patients undergoing radiation treatment. And we found that we have over 75% of patients have chosen to complete and return our questionnaire. They're doing it reliably, they're doing it carefully, and we can now actually look at this information to try and figure out about the important aspects of care. We do have several different aspects of care. So we call these domains of personal care, and it's basically the different types of categories that we ask questions under. So they include things like the technical competence of the healthcare providers, the accessibility of the healthcare providers, the acceptability of the treatment environment. So we have a list of 10 of these domains or categories that our questions fall under. And what we found now that we're looking at information from patients about the importance is that the 3 aspects of care that are most important to patients are the technical competence of their healthcare providers, the empathy of the healthcare providers, and the communication. Both the communication skills as well as the content of what is communicated. We've looked a little further and we found that patients generally agree about these important aspects of care. So it doesn't seem to matter whether the patients are older versus younger, whether they have different varying education levels, or how they're reporting that they feel their current health status is. These are the 3 aspects of care that seem to be important to all patients.
So basically in brachytherapy, what we are talking about here is the prostate brachytherapy, that is the high dose rate brachytherapy. We actually implant this catheters inside the prostate, alright, and so prostate will, it's a prostate phantom. Prostate will look something like this. So basically it is done under ultrasound guidance.
We use an electromagnetic positioning system, which is similar to the GPS in the car. Instead of satellite, we have an electromagnetic field generator that generates electromagnetic field, and there is a sensor in the tip of this needle, which can detect those variations in the electromagnetic field, and based on that it can determine the position of the needle tip with a sub-millimeter accuracy. And the first step is that we have to register the CT coordinate system to the coordinate system of this tracking system. So we first show how it is done. So you can see on the screen the CT scan of this phantom, and if you can magnify 3D view, you can already see that the needle is moving as I move it. But right now, before the registration, let's say I type this cross on the phantom, the needle is not at that position. So this is before the registration when the CT image and this electromagnetic tracking system is not yet resistant to each other. So then I will attach these fiducial markers on the phantom. Similar markers can be placed on the patient's skin. So this will be used to register the image coordinate system to the electromagnetic tracking. Yeah, for the guidance you can use ultrasound, and also you can highlight the position of the needle on the ultrasound. Usually when there is only one needle, you can clearly see that, but you do this insertion sequentially. So once you insert a catheter, then you keep it there and insert the second one, the third one, the fourth one. So there are more and more clutter in the image, and it's less and less easy to see where your current catheter is. So with this tracking system, you can highlight the actual position of the catheter. You don't need to see it clearly on the ultrasound image. And you can also track the needle as it is inserted, so you can digitize the catheter tract and not just see the final position, but see all the catheter points. So we'll show an example for that later. So now for the registration, I will attach the each point. So 5,
Okay.
6,
Okay.
7,
Okay.
8,
Okay.
9,
Okay.
10,
Okay.
11.
Okay.
So now the program automatically computes the registration between these two coordinate systems. So after that, when I touch a point here, I should see that the same point is touched on the virtual models on the screen. Yeah, so you can see that I touch this cross at the top, it touches that, the fiducial marker, so it is very nicely aligned. I don't know what was the accuracy that was reported, but it's usually below 0.5 millimeters, sometimes 0.2, 0.3. So it's quite accurate. So once we have a good registration, we can see the real time. Insert your needle in the catheter and push it through the catheter till the end. And in the meantime, you can see the guidance screen, so you can see the image, the needle in the image, in the CT image. If you have an ultrasound image, then you can show it the same way in ultrasound. You can also fuse CT and ultrasound. So this way, sequentially, we can digitize all the catheter paths. So insert it.
Because we've been collecting data on both importance and quality using the money from Ride for Dad, and that's really what it supported, once we know about the importance, we can really start to look at the quality of care that men are receiving. And hopefully, by working with managers about what we're finding, we can potentially identify some targets or some areas that may be beneficial for quality improvement. We can identify the areas where quality is fantastic at this stage, and then perhaps in the future we may be able to improve the experience for patients as they're going through radiation treatment.